We begin in Delta State, where the wife of Nigerian President, Senator Oluremi Tinubu, has called for a robust advocacy that would expand access to HIV testing services with comprehensive counseling, treatment, and care for all individuals who test positive. Senator Oluremi made the call at the launch of the Free to Shine campaign and advocacy initiative led by the African Union, the organization of the African First Ladies for Development and Global Partners, held at the Dome Event Center, Asaba, the state capital. She harped on the need to deepen engagement with traditional faith-based institutions with a view to addressing cultural and religious influences on HIV prevention behaviors, especially those engaging in virtual services. The First Lady of the country disclosed that advocacy was the key for the nation to avoid and live free of all the transmissible diseases, stressing that the goal of the campaign was to address the growing complacency in the response to the spread of HIV and AIDS. And according to her, Nigeria, being the country with the highest burden of HIV/AIDS in sub-Saharan Africa due to its large population, faces significant challenges, adding that the burden was particularly severe among children, youth, women, and marginalized groups. She also advocated for a triple elimination of HIV/AIDS, syphilis, and hepatitis B 2030 by 2030 across the 6 geopolitical zones of the nation. She revealed that just 2 years ago, 15,000 children aged 0 to 12 lost their lives in AIDS-related illnesses, and noted that the ongoing challenges faced by these children underscored the urgent need for sustained action to improve prevention strategies, enhance diagnosis, and expand access to treatments.
The Free to Shine campaign is an advocacy initiative led by the African Union, the organization of the African First Ladies for Development and Global Partners. The goal of this campaign is to address the growing complacency in the response to the spread of HIV/AIDS in Africa. Nigeria being the country with the highest burden of HIV/AIDS in sub-Saharan Africa due to its large population, faces significant challenges. This burden is particularly severe among children, youth, women, and marginalized. TB is no killer. Just make sure you get treated. Please, those two, because they are contagious, you have to get treated. That's why we are here today. But I'm so glad that our young people, and I see them just looking at, as if they are invisible. So please, we have to do what is right. To complement the Free to Shine campaign, I've also decided to advocate for the triple elimination of HIV/AIDS, syphilis, and hepatitis by 2030. The campaign will cover 6 geopolitical zones of the nation. We launched the maiden campaign for the North Central Zone in Kwara on 30th January 2025, and that of the Northwest Zone in Kaduna on 2025 February and 25th February 2025. Today we are flagging off the campaign in Delta State for the South-South Zone. By the grace of God, the next zone to benefit will be the Northeast, and Taraba states will be the host. The Free to Shine campaign seeks to significantly reduce new HIV infections among women and reproductive age, prevent mother-to-child transmission, vertical transmission, and ensure that every child born with HIV receives the necessary treatment.
In his remarks at the ceremony, Governor Sheriff Oborewo recommended Senator Oluremi Tinubu and the Organization of African First Ladies for the development for the renewed drive to tackle the spread of HIV/AIDS among women of reproductive age, elimination of mother-to-child transmission, and treatment of children born with HIV/AIDS. He said the campaign was a giant step towards addressing the gender-sensitive concerns of sexually transmitted diseases and reproductive health issues, as highlighted in the Beijing Declaration of 1995. He noted that available data indicates that women aged between 15 to 49 years are twice more likely to be living with HIV than men.
High Excellency, Senator Oluremi Tinubu CN, and the Organization of African First Ladies for Development deserve commendation for the renewed drive to tackle the spread of HIV/AIDS among women of reproductive age, elimination of mother-to-child transmission, and treatment of children born with HIV/AIDS. This is a giant step forward towards addressing the gender-sensitive concerns of sexually transmitted diseases and sexual and reproductive health issues, as highlighted in the Beijing Declaration of 1995. And as government, we shall complement the effort of the First Ladies of Africa by ensuring that women are continuously empowered to make decisions for their economic and physical well-being. You will recall that the Beijing Declaration of 1995 advocated for increased policy and program investment, including skills development, to expand female participation in all strata of the economy. I am pleased to inform you all that the empowerment of women is one of the cardinal objectives of my administration mole agenda. Your Excellency, you will recall in August 2024, I intimated you of our modest effort to empower the women folk through the More Grant scheme for petty traders, artisans, and female entrepreneurs.
Governor Borewori said his administration would continue to complement the efforts of the First Ladies of Africa by ensuring that women are continuously empowered to make decisions for their economic and physical well-being. Minister of State for Health and Social Welfare, Dr. Isiaq Saloko, lauded Senator Oluremi Tinubu for renewing the health of Nigerians and helping to secure a healthier future for the country. He applauded her relentless commitment to bring together key stakeholders and harness political commitment at the highest level in the pursuit of the noble goal of improving the health and productivity of Nigerians.
Without any equivocation, that with interventions such as this Free to Shine program, Her Excellency Senator Oluremi Tinubu, CON, is truly renewing the health of Nigerians and helping to secure a healthier future for our country. Intervention to end TB in Nigeria, to reduce the burden of cervical cancer in our country, improve nutritional status of our people, upgrade the livelihoods of many Nigerians, has become an invaluable component of the Renew Hope agenda of President Bola Ahmed Tinubu, GCFR. Your relentless commitment to bringing together key stakeholders and harness political commitment at the highest level in the pursuit of the noble goal of improving the health and productivity of Nigerians has been phenomenal, and it is catalytic in helping us to get things done in the health sector. I wish to therefore appreciate you, ma'am, for your passion, your dedication, and commitment, which is giving Nigerians, especially women, children, and youths, the leverage to shine, free from preventable diseases and from poverty.
Earlier in her welcome address, the wife of the state governor and founder, You Matter Charity Foundation, Dickness Tobore Borewori, said the flag off of the Free to Shine initiative will help to advance the fight against mother-to-child transmission of HIV/AIDS and assured the First Lady of her support in her desire to reverse the ugly trend in the health sector.
People of Delta State, to congratulate you on your appointment as a member of the Steering Committee of the Organization of Africa First Ladies for Development, Upland, as an appointment well deserved. Today is the day 2 of your visit to Delta State, as you bring to the grassroots the triple elimination campaign of HIV/AIDS, syphilis, and hepatitis among women of reproductive age, which is tagged the Free to Shine program. The campaign is also the elimination of mother-to-child transmission and treatment of children born with HIV/AIDS. This event is timely as it as it complements the Delta State government in advancing the health needs of Deltans through the MORE agenda, especially pregnant women and children under age 5 in the state. The elimination of HIV/AIDS, syphilis, and hepatitis among women of reproductive age cannot be overemphasized. Therefore, all hands must be on deck to achieve this goal. I wish to use this medium to call on well-meaning individuals, organizations, and donor agencies to be part of this move to eradicate this plague. This will help in addressing the challenges of safe delivering of our women and the growth of our children. Finally, I believe that after this program, we will live in an environment where HIV/AIDS, syphilis, and hepatitis will be reduced to the